Hi guys, good morning and welcome to another session of AMA with Dr. Ben Benham. I'm Dr. Ben. I'm the board certified dermatologist and one of the founders of Happy It. Welcome, happy Tuesday. So just as a disclaimer before we start, I just want to remind you that this information here is for educational purposes only and is not meant to provide medical advice or service. Please do not rely on this information to make medical decisions, and remember to discuss the risks and benefits of any treatment with your medical doctor before starting. So August is Hair Loss Awareness Month, and today we're going to be focusing on stress and hair loss. And really, the whole idea is that we want to open up the conversation, that everyone just openly shares and talks about hair loss issues. According to Mental Health Foundation, 74% of people really feel overwhelmed and stressed on a daily basis, and some of that could actually lead to manifesting as hair loss. So we can't remove the stress, but we could definitely help basically with the hair loss. So I'm going to start. We'll start with some of the questions that we have, and then we'll go from there. So from looking at a number of studies with regard to latanoprost, 0.1% is what gives the best results. Your product has 0.005. Just curious, why is it so much lower? That's a very good question. Couple of reasons. First of all, there are also studies that show that a little bit of latanoprost does help. We also have other ingredients in it, so we didn't want to bombard our product with a high dose of latanoprost to avoid some of the side effects. Also, latanoprost is a very, very, very expensive medication. Companies that are selling that latanoprost 0.1%, the medication is selling for $200 to $350 on a monthly basis, and we just don't. It's just too expensive for like a lot of our customers to buy it. So that's why we want to include some, but you just can't do it as a high dose. It's just a very, I think every gram of that is literally $5,000 world sale price. So that's really one of the main reasons. But I think in the future, we are basically looking forward to making it 0.1%. But again, there are some companies that already make it out there, but it's about $200 to $300 a month. I feel, and also I don't think that latanoprost is that amazing of a drug, and I feel the combination of minoxidil and finasteride certainly supersedes and works much better than latanoprost. In fact, the company that made Latisse did a clinical study of using latanoprost on the scalp, and they dropped it halfway, but it didn't think it made that much of a difference on the hair. There was one that I just crossed out. Okay, my hair fell out a little bit in the hairline, but more on both sides, and I want to grow. I'm 59. I always had a lot of hair. So will this product help me? Yes. So the answer is yes, it could help you. Remember, results varies and everybody basically does differently. My recommendation is to use the products twice a day, every day, and do it for about 4 to 6 months. If you feel that about 6 months that you're not seeing the results you want, you can always add an oral medication like oral minoxidil, one of the super capsules, for better results. I feel that there are more spaces on my scalp than before using Happy Head. Why may that be? So initially, Happy Head could cause an initial hair loss, and that is normal. That's due to mainly to the minoxidil. Those patients that actually have initial hair loss from the minoxidil, they're actually doing really well. They're actually the ones who are going to probably do the best. So just keep it up and keep on using the product. I'm using a leave-in conditioner. How does that affect the application of Happy Head? It really doesn't, actually. We do like leave-in conditioners. It does reduce some of the irritation that could come from Happy Head, so keep on doing it. Can I apply Happy Head after conditioning my hair? Also, if I use a dermal roller, will the condition decrease the effectiveness of your product? What a leave-in conditioner is, for people that don't know, is basically a conditioner that you put on at the end of basically a shower right before you get out, and just leave it on. So you could leave it on, and then basically once it's dry, you could apply Happy Head product and rub it in, and you could definitely do a roll on top of it afterwards, and it should be perfectly fine. I recently added topical finasteride to my minoxidil topical routine and noticed a lot of hair shedding after 2 weeks. Is this normal, and should the shedding subside? So adding the topical finasteride should not really cause a lot of shedding. That's a little bit unusual, but obviously it could happen. It is normal to some extent, so it will subside. It could just take 6 to 8 weeks. How does stress cause hair loss? That's a very good question. So the way that stress causes hair loss, that it actually increases your cortisol level, and cortisol level has been linked to pushing more of your hair into the telogen phase, and that's how it basically cause more of the more hair loss. Will reducing my stress help from already losing your hair? Yes, absolutely. Reducing your stress will help reduce basically your hair loss. Obviously, it's not gonna happen overnight. It does take some time, but obviously meditation is really good. Which stress lowering techniques do you recommend? I love meditation. I think that's great. Going out for walks. Look, unfortunately, sometimes it's very difficult to reduce that stress. But meditating, sitting in a quiet room, I'm telling you, putting your phones away, not being on Instagram, all those will reduce your stress level overall. How do happy head products combat the effect of stress in hair follicles? So what happens is that obviously happy head is not going to reduce your stress level, but what it does is it's going to affect the end game. So it's a testosterone blocker that prevents DHT, and then it also increases blood flow. And by doing that, you're basically targeting one of the two main cause of hair loss. And by doing that, you're going to reverse the miniaturization and slow down the hair loss, and it will also lead to hair growth as well. Can you really grow hair at temples, and does it ever grow in the hairline area? So it depends. Look, this is the temple area right here. And it's actually, if you could look at the temples and see a lot of hairs, but you could just see through the scalp, your hair could grow out, especially if you put the topical and you apply the derma roller on it. I have a lot of patients in my office that come and they want to do PRP for this temple area. And I always say, look, you could see very good results by doing the happy head with a derma roller. Now, if you look at the temples and there's no hair at all, then nothing is going to grow out. So it really all depends on the amount of hair that you already currently have. I have CCCA. Can this help? Should I continue to take HIMS? So, HIMS has a very similar product to ours, but ours has 3 active ingredients that are topical, whereas HIMS has 2 active ingredients. For CCCA, what it is, that's a scarring type of hair loss that happens in the crown area, typically in African American females. I believe that's a very tough condition to treat, and ours is not indicated for it. Even the HIMS is not indicated for it. What I've seen is that if you do the oral medication and topical, you may have a chance that it may help. But again, our products are not indicated for it, and in fact, I don't think any products are indicated for it. But it's not going to hurt trying. I've been using Happy Head for the past 7 months, and it seems that now in the last 2 months, no more hair growth, and no more new hair is growing. Do you recommend any higher dosage? Great question. So let me understand this. So you used Happy Head, saw a lot of growth in the first 5 months, and it's plateaued in the last 2 months. So you could go on a higher dose of Happy Head. If you plateau, sometimes you could also go on the oral Happy Head, the super capsule, and that could also help you as well. So you have these 2 options. Reach out to help a Happy Head and see if you could probably add the oral. Probably adding the oral medication is probably going to give you basically the better results. Do I apply after or before shower? You want to apply the Happy Head after shower. That's when you apply the Happy Head. Not before shower, then you gotta wash it off. The only instance where I would say apply before shower is that some patients might get very irritated from the product. That's very rare, but it could happen. So our recommendation is basically apply the product like 7 o'clock at night, and then 9 o'clock take a shower to wash it off. And it's still gonna work pretty well. Okay, I believe you mentioned in the past that you do not recommend men taking creatine. I agree. That's exactly what I said. I've been taking 5 milligrams per day for about 6 months, and I'm not seeing any negative impact on my hair. But could you again state how you feel about it? So this is what I think. What's going on is that when you take creatine, you can look up these studies, is that creatine basically feeds directly into the testosterone pathway, eventually increasing testosterone and increasing your DHT, dihydrotestosterone level. So by doing more creatine, you're elevating your DHT level, which means you're more likely to have miniaturization of your hair. Now, you've been using it for 6 months, you haven't had any side effects. You're lucky. That's great, but not everyone's going to be that lucky. So our general recommendation is for you not to do creatine. Um, I've been using Happy for 6 months now. My bald spot hasn't changed, although I've seen some tiny, fine, short hairs. I'm wondering if I should continue. I'm also concerned about the internal hair growth medication due to potential ED. What do you recommend? So, again, guys, so there's a difference between thinning and balding. Thinning means that you look at the scalp, you still have a lot of hair, but you could see through the hair, so you could see the scalp. Balding means that you look at the scalp and there's absolutely no hairs there. So in your case, I've never seen your hair, so I don't know how it looks. But if you're really bald, there's no hair there. I think it's gonna help you, but not much. I mean, as you've said, you are seeing some tiny, fine, short hairs, which is great, but I'm not sure how much more is gonna help you. The medication, the oral medication, some of them do have some AD potential. Unfortunately, the oral medications. So if I were, I would probably continue the topical, but I would add oral minoxidil. So we have two oral medications. One is oral finasteride, one is oral minoxidil. Oral finasteride does have slightly higher risk of sexual side effects. Oral minoxidil has no risk of sexual side effects. So I prefer that you couple the oral minoxidil with a topical happy head. And guys, by the way, we are coming out with a new product that could potentially practically reduce significantly all the sexual side effects associated with oral finasteride. It's an oral finasteride product. It's not out yet, but we're currently working on it. That's probably going to be released in the fourth quarter, sometime in like November, October time. We're very excited about it. Can I start taking oral minoxidil spironolactone at the same time immediately as a topical solution without doing the 3 to 6 months of topical solution? What I would do, yes, you could kind of start at the same time. I would probably use the topical first, maybe for like about a week or two, let your body adjust to it, and then start doing the oral. Yeah, so you don't have to wait the 6 months to start the oral medication. You can couple at the same time, but just give it like a 1 week lag. Any side effects from doing the oral and topical at the same time? Um, I mean, you could increase the side effect. I mean, in your instance, you can increase the side effects of the minoxidil side effects, which is feeling dizzy, lightheadedness, headaches, heart palpitation. But if you ease in slowly into it, you're going to eliminate those side effects. So just ease into it. There's no rush, and this is not a race. Which blocks DHT better, finasteride or dutasteride? Great question. So there's an enzyme, actually there are two enzymes, 5-alpha reductase 1 and 5-alpha reductase 2. They're responsible for taking testosterone and converting it to dihydrotestosterone, known as DHT. Finasteride inhibits one of those enzymes. Dutasteride inhibits both of those enzymes. In clinical studies of comparing oral finasteride to oral dutasteride did a significantly better job at reducing hair miniaturization and causing hair growth. So dutasteride is technically a better drug. We have both topical dutasteride and also the super capsule oral dutasteride combined with minoxidil. So dutasteride is typically a better drug. You have to realize that oral dutasteride is not FDA approved for hair loss. It's an FDA approved drug that's being used off label. So because of that, a lot of doctors just use finasteride first because that's like the most common used one. And if you don't have any side effects from it, and if you don't see good results, then we typically switch patients over to dutasteride. If you're on the WB formula, what are the positive and negatives of switching over to a super capsule and stopping the topicals? Will side effect increase, or will hair growth be impacted? Great question. So the topical formula in clinical studies has been shown to be as effective as the oral finasteride. Our super capsule has finasteride, minoxidil, vitamin D all combined in one. And I do believe that the oral super capsule is probably a stronger medication than a topical. But also anything oral could also carry just more risks. So it really all depends. I've been using the formula and you're seeing good results, I would just continue the formula. If you've been using the formula and you feel the results are not that great or you have plateaued, then I would add the oral medication. So you could add the oral super capsule or you could add the oral minoxidil. But whatever you do, guys, titrating up and easing into it is probably one of the most important things you could do. What is the best time of day to take finasteride? I don't think it really matters. For oral minoxidil, probably you want to do it at night. So if you do get any blood pressure changes, you're sleeping, but I don't think for finasteride it really matters. Can any hair grow at the temples where no hair exists? No. If you have no hair there, no hair is going to grow. So, I mean, unfortunately, only hair transplants is the only option. And that's also true for like guys that are balding here. I mean, if you're completely bald, I mean, it's just not going to grow. Is it safe to use Happy if you have psoriasis on your scalp? So, we just actually did a video, Instagram video about that, which will release shortly in a few weeks. So if you have psoriasis on the scalp, the problem with psoriasis is that you have a lot of redness, inflammation, and flakiness, and that could damage your hair follicle by itself. So it's important to treat your psoriasis, and we are coming out actually with medications at Happy that will that's addressing psoriasis or severe dandruff. So number one, address the psoriasis. Number two, happy could sometimes cause irritation, so that could make your underlying psoriasis worse. It's unlikely though, so I would still try it and see how you do. You could also purchase like a scalp serum that you could just buy on Amazon, and these are just really hydrating serum, and they will reduce some of the irritation. Also, another thing that's important is that let's say you put the Happy product on and you do get irritated, you could wash it out after 2 hours, so you don't have to leave it on all day. So you could just put it on like 8 o'clock at night, wash it out by 10. That will reduce the irritation. But if the psoriasis is really bothering you, I would definitely see someone to treat it because the psoriasis itself could damage your hair follicles. How can I blow dry my hair after using Happy Head? Great question. Put the Happy Head on, let it dry first. Don't light a match on your hair because it is alcohol based. Don't set it on fire. Let it dry first, and then you could blow dry. Again, in my opinion, blow drying is that you don't want to have it on a really hot setting because that could damage your hair. And that could probably be another actually Instagram talk we could have actually one of these days. Is it safe to use Happy Head when ongoing chemotherapy? Definitely run it by your doctor. Some doctors are okay with it, and some doctors are not. It depends what you're doing the chemotherapy for. But most of the time, doctors are okay with it. But please ask your own regular doctor. Can you let us know if any, negative studies you may know of as to potential side effect of dutasteride, such as having anything to do with cancer related to coming out pertaining to this drug? So, I'm not sure about dutasteride and cancer. However, finasteride does have a breast cancer. It's not a warning, kind of like a breast cancer written on it by the FDA. Reason is, if you look at one of the original clinical studies of finasteride, and I highly encourage everyone to do this, there was no statistically increased risk of breast cancer in males, but there were a couple people that had breast cancer. But when you look at a large cohort, like we have thousands of men in the study, there's some patients that will randomly get some breast cancer here and there. So I don't think there was any statistically increased risk, but there were definitely some patients had it. But that's usually the case, in like a lot of the studies. With respect to dutasteride, I don't know the answer, but I think FDA has what's called like a class side effect. So they would put the side effect on any drug in that category. So I think it has the same breast cancer side effect written on the FDA profile. Can I dye my hair while using Happy Head? Absolutely. So here's my opinion about dyeing your hair. So when you dye your hair light or highlights or go blonde, that could actually really damage your hair because the way it works is that you need peroxide to remove some of that pigment, and you need to do this in a multiple steps. So imagine every time you add peroxide to your hair, you're really damaging a lot of your hair. So I highly recommend for like a lot of my female patients, do not go lighter. Going darker it's better. It's okay, especially if you get like the ammonium-free products. Should minoxidil stop seasonal or summer shedding, or will temporary high shedding still occur on oral minoxidil? I mean, everyone's different. I mean, it could still occur, but less likely. Um, does the shampoo and conditioner a person use usually make a difference since it's only on a person's hair for a minute or two? That's a great question. Usually, the way I believe is that I don't think shampoo and a conditioner for 1 or 2 minutes will make a huge difference, in the overall hair growth. There is a study on the ketoconazole shampoo that showed that actually applying ketoconazole is equivalent to using topical minoxidil. But again, I feel it's just more important to do the oral medication or the topical Happy Head. I think those are going to have much more significant impact. The shampoo will help. It has synergistic effect, but alone by itself, I think the effects could be very minimal. Can African American men develop CCCA? That's a very good question. I guess it's possible, but it's unlikely. CCCA sounds is a very special, unique form of loss, typically in uh, female African Americans, but I guess males get it, but it's unusual. Can retinol in a topical solution cause more natural flakiness? Yes, it could, but it's a very low dose of retinol. And if it does bother you, remember, Happy is a customizable product. In contrast to all of our competitors, we don't make these products and sell out to thousands of patients. It's literally customized for you and sent out. So if you feel the retinol is bothering you, just let us know. We'll take the retinol out. We'll make a fresh new batch for you, put your name on it, and ship it out. Hey doc, I've noticed that my feet has swollen a bit. I've been using the Happy product for 7 months. Do you think it's one of the side effects? So minoxidil has been associated with some of the swelling of the legs. From topical, it's very unusual, but it could happen. It's very unusual. So in your case, it could be from the topical. My recommendation is that I reach out to HappyEd at help@happyed.com and tell them to reduce your minoxidil concentration, maybe from 8% to 6% or lower, or we might take it out and see how that does. But yes, it could be one of the side effects of HappyEd. Can I get HappyEd without the glycol? It makes my hair feel dry. Yes, we do have what's called the water-based formula. And yes, so you just have to request it. So send an email to help at HappyHead, and we could see. Let's see if we could get that product for you. What are side effects of dutasteride? So oral dutasteride has very similar side effects to oral finasteride. The most common side effect that people fear is the risk of sexual side effects that could happen in about 2 to 4% of patients. Erectile dysfunction, testicular pain, testicular numbness, lack of erections, lack of desire to have sex. There's also risk of depression, anxiety, which is extremely low. So those are pretty much it. Usually dutasteride has what's called a longer half-life, which means that it's going to stay in your system for much longer time. I've read all the clinical studies comparing oral dutasteride to oral finasteride, and I haven't seen if a patient were to get side effects that it's going to be longer lasting with dutasteride. But that was one of the theories at the beginning, and that's why a lot of doctors want to prescribe it initially. Hey doc, you mentioned there's an oral method. The oral method may have more side effects than the topical. What are those? Oral finasteride or oral minoxidil could have more side effects than topical, and this is why we initially created HappyHead, because HappyHead, the topical in studies has been shown to have a low risk of side effects. So, and this is why we still love the topical HappyHead, and it's still one of our best-selling medications. However, there's some people that do take the oral medication and have no side effects. So remember, the sexual side effect profile on the oral medication is 2 to 4%, on the finasteride 1%. So which means about 95% of people don't have side effects. So, and you could be part of that 95% that doesn't have side effects. I have scarring hair alopecia due to COVID about a year ago. Can this product help my hair? I was told hair implant is the only option. Well, it depends. I think you really need to see a dermatologist. First of all, COVID typically doesn't cause scarring hair loss, number one. Number two, if you truly have scarring hair loss, the implants wouldn't work. And certainly sometimes the topical wouldn't work either. The topicals are not designed for the scarring hair loss, but I know of patients that have done both the topical and the oral simultaneously, and they've seen some results. It doesn't mean that it's going to work for you, but I've seen some results in other patients. Again, so you could give it a try and see what happens. What diet do you recommend for hair loss? So great question. So for hair loss, we love high protein diets, which means a diet that you're basically eating a lot of avocados, cashews, chicken, eggs, high protein diet, and a diet that is you're also taking vitamin D, your iron, and multivitamin, and adding collagen to it. If you're a type of person that's vegetarian, I would add basically protein powders, and the protein powder I would add is either pea protein or whey protein concentrate. Do not use whey protein isolates. Also, I would still stay away from soy milk for guys, energy drinks, DHEAs, anabolic steroids. Make sure your chicken is organic, cage-free chicken. And also no creatine. and minimize the alcohol, and please do not smoke. Smoking is really bad because the nicotine as the vaso constricts the blood flow, and you prevent blood from getting to your scalp, and that will cause hair loss. Um, have you had patients with CCC and happy head that happy head treated? Again, we don't typically recommend. Uh, it's not indicated for it, but if patients want to use it, they could use it, but we just tell them that may not work. But yes, we've had patients who have CCA and use happy head. Can exercise? Can I exercise after applying happy head? Yes, absolutely. You would. I mean, definitely. Just let it try, and then you could exercise. The problem is that sometimes when people sweat a lot, you get some of the medication on your face, so that could be the only problem. The only problem. Can I swim after applying happy head? Well, the problem with swimming is that you're just gonna wash it off. So, I mean, I would probably apply happy head after swimming. Should I be using sunscreen on my scalp? Absolutely. I think that's very important to prevent skin cancers. Hey, doc, you mentioned for me that the oral method because I've plateaued with the topical. What is the name again so I could call it in? So just reach out to Help a Happy Head and say that I want to go on the oral medication. We do have there's three oral medications. One is oral minoxidil, which is the one that has no risk of sexual side effects. The other one is oral finasteride, which is the one that carries slightly risk of sexual side effects. And there is the oral super capsule, which is minoxidil mixed with finasteride combined together. So if you're very afraid of the sexual side effects, I would probably just do oral minoxidil. So just call in the office and say, look, or email them and say, look, I also like to add oral minoxidil to my regimen. You can also go to our website to the product section and order it as well. Thank you so much for that question. Guys, so just a couple things. So Happy Head is a customizable formula, which means that since we have three ingredients, finasteride, minoxidil, retinoic acid, if there's one of those ingredients you don't like, you could actually take it out. Other ingredients also in it is also some hydrocortisone and in the aloe base. But we could really take a lot of those things out depending upon what you want. And the product is made fresh and shipped out for you on a monthly basis. Also, again, in the next few months, we are very happy to introduce. We're going to be introducing several new products, and one of them actually is we did introduce Latisse basically for your eyelashes. We also came up with an eyebrow product, and we are getting like our really cool derma rollers in stock in the next few weeks. We're also coming up with a new oral medication that's finasteride combined with another medication that actually has been shown clinical study backed up that it actually reduces some of that sexual side effects of oral finasteride. So we're super excited. What kind of derma roller should I use? I like the 0.25 millimeter derma roller. You don't want to be very aggressive. Do it gently, light. Make sure you're not constantly in one area. You're going to actually want to move it around. What are the pros and cons of the super capsule? So we're a big fan of the super capsule, and the reason is because it really streamlines the entire process, and it's great for guys that are lazy like me. I mean, it's great. So typically, there's three medications. There are finasteride, minoxidil, and there's vitamin D that we've taken and we've combined it all into the same product. Now, finasteride does have risk of sexual side effects. Minoxidil does have risk of lowering your blood pressure. So the risk with everything, but what we recommend is to touch it up slowly. And if you go up slowly, I think you're going to be just fine. But it's a great drug. Patients absolutely love it and has really changed the field of hair restoration. So, guys, thank you so much for joining us on another Happy Head call, and thank you for the team here who's made everything possible. If you'd like to get started with the customized treatment of Happy Head, you could use my code AskDrBen60, basically for 60% off your first order. Also, please, we really love you guys to get on some of our mediums to write like a review for us. I would really appreciate it. You can on Trustpilot or Facebook. We really always enjoy having you guys write reviews. And if there's any question, you can also reach out to us at Hella Happy Head. And thank you so much for using Happy Head. And our success is really based upon you guys, and we really welcome all of your questions. And our next session is going to be on September 5th at 10 a.m. Have a beautiful day. Again, thank you for the team for making this happen. Have a great day, everyone. Bye.